We'll start. So welcome everybody to tonight's Family Care Enhancement Project's information series on early and periodic screening, diagnosis, and testing, or EPSDT is what you'll hear it be referred to as tonight. The Family Care Enhancement Project is a project that is housed at the Munroe-Meyer Institute, and I am a parent resource coordinator in the project, and we are parents of children with disabilities or special or specific healthcare needs who are provided training to give that parent-to-parent support and education and helping to navigate systems and get connected to different services like early intervention or community services that families with children with disabilities need. We are also inserted in clinics to help meet the social determinants of health for families, which are those non-health related needs. We are a statewide program, which means that we have parent resource coordinators throughout the state. And there's all of the locations that we have. Just a couple of housekeeping items really quickly. We are recording this webinar, and all of our webinars are housed on our Munroe-Meyer YouTube page, or channel, I guess they call it. And that is the address right there. So it takes a little bit to get the videos uploaded and edited and all that, but you can also find past webinars on there if you're looking for something specific. If you have any questions for Jordan, if you could just submit them via the Q&A function at the bottom of your screen. And we do have a very, very short survey that will pop up on your screen after you close out of the webinar. If you wouldn't mind completing that for us, it's just 2 or 3 questions. So very quick, but we really appreciate getting that information from that survey. And for tonight, we are very excited. We have Jordan Himes. She is in the Marketing and Communications Department at Medicaid with Health and Human Services. She's going to be presenting for us tonight again on EPSDT. So thank you, Jordan. There's my information. Again, I'm a parent resource coordinator. If you have any questions about the webinar, if you have any questions about our Family Care Enhancement Project program, feel free to email me and I will help you get those questions answered. Okay, and I will stop my share and turn it over to you, Jordan.
Yeah, thank you very much, Jennifer, and thank you for having me today. I will go ahead and share my screen of our presentation here. To start out, I will give the obligatory apology if one of my dogs barks or I cough during this presentation, because both are possible at this time. So hopefully that everything will go smoothly, but I do apologize, like I said. So yes, today we are going to be covering early periodic screening, diagnosis, and treatment, otherwise known as EPSDT. Many times people get the acronym wrong, completely understandable, but we, again, will help as much as possible. So today's discussions, we will be doing some introductions, which thank you, Jennifer, for just completing. Defining EPSDT. I will be providing to you some federal and state guidelines that may come in handy for you as you're navigating the system. You may not need to know all the information, but I wanted to include it in these slides and in the copy that you were provided, just to make sure that in the event that you needed it, you do have the information. Managed care services, medical necessity, Nebraska waiver programs, and resources. All right, so today, as I said, we're going to define EPSDT. Nebraska's EPSDT program is also referred to as health check or well child visit. I apologize, I'm just going to minimize myself here. Okay, so it is also referred to as health check or well child visit. And the program is designed to ensure that individuals under age 21 who are eligible for Nebraska Medicaid receive regular and periodic screenings with the overall goal to improve health outcomes. Our periodic screening system is really put up for us by the American Academy of Pediatrics, and they really suggest those guidelines and the frequency for those exams. I will provide some information on that later on, and some of that information was shared prior to this prior to this meeting as well. So hopefully that can help provide you a little guide if you need it to reference at any point. So again, we're going to break this down by each of our different topics. So we're going to start with early. Our goal is to assess and identify problems early in order to allow for the best opportunity to provide helpful treatment and care. EPSDT exams begin at birth and will continue. For this sake, we're going to talk about until a child is until age 21. But of course, in Nebraska, we have age 19 as well. So you'll see some different dates thrown around, although for this purpose of this presentation, it will be until age of 21. Well-child exams allow for the provider to assess growth, development, health, and wellness, and they can also take action when there are concerns that arise. We hope that this helps prevent more serious issues from developing, and we have found that this is a proven way to help prevent those issues and address them at the earliest case scenario. Oh, sorry, my slides jumped there. So when we say periodic, we're talking about the American Academy of Pediatrics. They established a recommended periodicity table for the best practice in EPSDT. A provider can establish an alternate schedule based on the medical necessity or if they feel it's needed for the patient. So as I said, this schedule was attached to the meeting invite earlier today, and then also it can be found online as well. We're really, at this point, just including it in case you want to know the average period at which people should be tested and whatnot. But like I said, we hope that it just is a little bit helpful for you. And again, moving on to screening, an EPSDT exam must include health and developmental history. So a patient's history must be completed at the initial visit during periodic exams. The history must include the patient's contact information, description of family, medical and behavioral health information for the child, an assessment of nutritional status, and risk assessment to identify any mental or substance abuse concerns. And we're going to continue on with screening just a little bit. So these screenings are comprehensive. We do start with an unclosed physical exam. These exams must be completed during the initial visit and during all periodic exams afterwards. This component must include a physical growth evaluation, a check of the organ systems, and a check of the general appearance of the patient's overall health status. And again, immunizations as well. These checkups should include the proper immunizations that are based on the age and health history of the patient. That information can also be found in the document that was provided to you, that big colorful table there for you, and hopefully we can provide a little bit more information as we go on. They also include laboratory tests and health education. Laboratory tests include testing for blood, and then also a doctor can determine all the additional tests that may be needed based on the patient's needs. Again, health education. So the doctor must also provide information on the child to the child's parent or legal guardian of what to expect as they continue through the appointments. We also do vision screenings, hearing screenings, and dental screenings. All of these go throughout the child's life. Vision and hearing should begin by 3 years old, and dental screenings should begin by the 1st year. Prior to the age of 3 for vision screenings, the child should be included in their family's history and well-being. Again, so if there's a history of vision issues within the family, that information should be brought up so that maybe those tests would begin a little bit earlier. And for hearing screenings, if a child fails on a response of 30 decibels or more in any frequency within their ear, a referral to an audiologist must be completed. And that again just ensures that we catch and help alleviate those symptoms as soon as possible. Again, developmental screening is one of the things that are very highly covered. Children should be regularly screened to ensure that they're meeting age-appropriate milestones in development. Again, a lot of these resources for age-appropriate milestones can be found online. but the Nebraska Early Development Network does help assist with service coordination and can help parents with guides to go through the process. I will just go ahead and, oh, I see that I cannot copy this link here. So hopefully I don't forget, and I can always share that link at the end, or if not, Jennifer, please keep me honest and I can share it with you after the fact. And diagnosis. When a screening indicates additional tests are needing, diagnostic services must be rendered to the patient. So again, those may be, if with a hearing issue, if they're showing that they didn't hear 30 decibels, then taking them into an audiologist, seeing exactly what the issue is that's going on and treating it. And again, treatment, when a treatment is identified by a doctor using screening, then they must help provide the services to treat the child. In treatment of special services are services that are covered to prevent, correct, or treat a disease or condition identified during screening. Those may include medical nutrition therapy, risk reduction services, well-child cluster visit, or lactation counseling. All of these do go based off of the severity of the child or the parent's situation. Again, what's going on for them and how bad do they need it, particularly with medical nutrition therapy. Necessary counseling is provided by a licensed medical nutritional therapist. The individual must have a condition that indicates a nutritional problem, or a condition of such severity exists that the nutritional counseling is beyond the normal standard that is needed. So again, that's just a quick example for you. They really do have to show the need for those services. And moving on to federal and state guidelines. Again, this is the section that I just wanted to raise awareness to, one that you definitely don't have to memorize by any means or always keep handy, but hopefully having these slides handy if you do need this information will be beneficial for you. So again, moving on to health check, the Nebraska Early and Periodic Screening, Diagnosis, and Treatment Program, as I said, that is what we call it here. It's a service available to all individuals aged 20 and younger who are eligible for medical assistance. So this would mean being eligible at Medicaid, being eligible on one of our waiver programs. This would really help them well round out those services. The health check program ensures that Nebraska Medicaid eligible children and their parents or caretakers have access to those resources that they need. And again, as I said, please do not memorize this, but Social Security Act, this was created for people under age 21 to provide treatment and assistance for chronic physical and mental disabilities. I did want to share these because oftentimes in our notices, they are cited or they're listed. So I just wanted to make sure that you all had access to that information and you could also grab it at the snap of a finger if you needed. And the Omnibus Budget Reconciliation Act of 1989 is supported by the Social Security Act. Again, this kind of goes through quickly, just all the different elements of EPSDT. So I will not go over them again because it is what we just went over, but again, just included for you. Centers for Medicare and Medicaid Services, otherwise known as CMS, does keep track of all Medicaid services in Nebraska. So we often work with them very closely. We do have weekly meetings with them, and they will always make sure that those services are being administered as they should be. Those services are administered through our health plans. So at this time, that is Healthy Blue, Nebraska Total Care, or United Healthcare. Starting January 1st of 2021, Healthy Blue will be phased out and Molina will take their place. So again, that will be Molina, Nebraska Total Care, or United Healthcare as of January 1st. So that was all with that quick little legal aspect for you. Again, just to have it for you. And now we're going to move on to the services provided by the managed care plans. To kick this off, a document was provided to you that helped kind of compare and contrast our current health plans side by side. I hope that you find it beneficial. Many of our members have the opportunity to choose the health plan that they need. But again, if they don't choose it, or they're thinking during open enrollment that they would like to switch over to a different health plan, they can compare that information side by side and know which plan works best for them. So our MCO contract requirements. All of our health plans are responsible for helping arrange EPSDT related services, and they all must provide the same base services to members. They are required to educate our members. That includes providing handouts, information, and welcome packets to them as well. This information must include the EPSDT program, and it must be given to them within 60 days of Medicaid enrollment. If it isn't handed out, then of course the member can always request it, or if they don't have their copy anymore, they can always request it again after the fact. And they can do so by reaching out to their health plan. Again, their health plan provides information about the services available to members under the EPSDT program. The services provided are at no cost to eligible members under 18 years old. Members will still have to pay the applicable enrollment fees, premiums, or similar charge that may be imposed on the medically needy recipients. These recipients are often under what we call share of cost. For your own sake, I will not get into that today. It is a very complicated topic, almost as complicated as EPSDT, but just for your general awareness, our members with share of cost do typically have a certain amount that they need to pay each month. That's typically around 50, anywhere from 50 to maybe $1, just depending on how much they're over Medicaid. So covered benefits. This includes prescription medications, therapy, vision and hearing services, mental health and substance use treatment, specialized pregnancy management, non-emergency medical transportation, and dental coverage. I do want to highlight again that starting January 1st of 2024, we will no longer work with MCNA. Rather, our health plans will be taking over our dental care. I just want to highlight that because I know you're still going to have access to this. And I want to make sure that you're aware that it will be changing starting in 2024. The goal for that is to make sure that all services are covered under the same health plan. We're hoping that people reduce their amount of time in urgent cares or hospitals for a last minute issue, and we're hoping to be proactive in those treatments. And care management. Care management provides direct support to members with complex health concerns. This can help members find providers and schedule appointments, identify community resources, arrange transportation, coordinate between different providers, work collaboratively with DHHS, and address needs to improve the quality of their life. Care management teams can include registered nurses, social workers, behavioral health counselors, and community health workers. Often a member of this team is going to be on your health plan, and they're going to be assigned to you. You're always going to be working with them. Unfortunately, we don't have enough staff over at DHHS at this time, so only very special circumstances have a certain caseworker assigned to them. Other than that, all of the information is shared amongst our caseworkers in our portals, so that way they can go on and anybody, whenever your call in is, can be able to help you. All three MCOs provide care management services, and you can request assistance by contacting your plan. You can figure out the number to contact them at just by looking at the number listed on your card. I say that because sometimes those numbers change, so I don't have them written down in front of me, unfortunately. And now moving on to medical necessity. I apologize, I'm going to pause quickly and just take a quick drink. Thank you. And now medically necessity services. EPSDT requires states to provide comprehensive services and furnish all medical coverable and appropriate or medically necessary services. These services are needed to correct health concerns for children under 21 years old. For the purpose of this slide, correct means to optimize their health condition, compensate for a health problem, prevent a serious medical deterioration, or prevent the development of additional health problems. So really, this is used as more of a working term as we go through it. And evaluating medical necessity, services and supplies that do not meet the definition of medical necessity are not covered. That would go the same for any Medicaid coverage. If it's something that we would not usually cover or it's not medically necessary, it would have to be paid for out of pocket by the member. For purposes of Medicaid fee-for-service, and again, that can also be done with spend down, they typically go hand in hand, and managed care, medically necessity is health care service and supplies which are medically appropriate. These services are deemed appropriate by the doctor. They render in a type of setting appropriate for the delivery of the covered services, and they're typically consistent in type, frequency, and duration of the treatment. So for example, if you were prescribed a medication for nausea, you had to be prescribed that medication once a month, and you needed, say, 6 pills for the whole month. That prescription would be going through every single month. That would be a medical necessity for you. Again, these are consistent with diagnosis of a condition, and they're required for means other than the convenience of the member or physician. So this isn't just helping them out, it's not making it easier, it's genuinely required to help that member. Determinations of whether a service is medically necessary must be made on a case-by-case basis, considering a particular member's needs. So again, all of these situations and needs go based off of the individual's needs and their current setting. So if they're having a very severe medical episode, for example, that situation may change based on the current state of their health. In authorization decisions, timelines for services that require authorization requests. Though you don't necessarily need to know this, it may be beneficial to have. So outpatient shared requests are completed within 14 calendar days. The reason I, again, wanted to share this is because if you don't get that within 14 calendar days, it's great to always reach out to your health plan or reach out to Nebraska Medicaid so that you can get some assistance. Or if you're on a waiver service, you could always reach out to the waiver as well. Outpatient expedited requests are completed within 72 hours, and inpatient hospitalization requests are completed within 72 hours as well. For medically necessity denials, peer-to-peer discussion can happen. So for example, a doctor can reach out to our medical director and discuss a denied request, hopefully appeal it that way. It is a little bit easier and a little quicker. Appeals can also happen. A complaint where you do not agree with a decision about approving or paying for care. That appeal process goes through the health plans and Nebraska Medicaid, and then we also review it, and then we determine whether or not that appeal can be overturned. In state fair hearings, everybody has a right to a state fair hearing, which is why it's included here. It is a legal proceeding. It's often used for when you don't agree with the decision and have completed the appeal process, and with the health plan and the decision was not overturned. So this, you would come into DHHS in Lincoln. I happen to know it's on the 5th floor. You would go through the appeal process. It typically takes about an hour or two, and then a open discussion would be had. We do have times where then the appeal is overturned and the individual does get that particular care that they're looking for, or it's talked about why it can't be approved, and then we go on from there on approaching it in a different way. Interperiodic screening. Screening exams can be performed outside the periodicity schedule when they are medically necessary. So as I said at the beginning of this presentation, if it's absolutely necessary, or if a doctor feels as though a patient is declining, they're always more than welcome to include another screening there so that they can make sure that they're keeping up with the patient's needs. These screenings are covered when they're medically necessary. They're used to diagnose an illness or condition that was not present during the regularly scheduled screening, or it has been determined that a change in a previously diagnosed illness or condition that requires additional services. The need for an interperiodic screening can be determined by your PCP or the primary dentist. A health, developmental, or educational professional who encounters the individual outside of the formal healthcare setting can also assist with this. Pre-authorized services. So we have a full list here of services or equipment that might require prior authorization. Again, this is something that might just be beneficial to have on hand. And that way, if you're not quite sure whether or not your equipment might need, for example, a nebulizer, might need prior authorization, that way you can just look at this list and know that it is. Frequently accessed care. So durable medical equipment, or DME, for members who are receiving EPSDT primarily serves a medical purpose, is appropriate for use in the home, can withstand repeated use, and includes adaptive equipment, aids, humidifiers, oxygen, and related respiratory equipment. Again, nebulizers or glucometers. That could include a thing to check your blood pressure. It could include a sleep mask if you have sleep apnea, anything like that. That would be included under DME. Therapy for members who are receiving EPSDT, this must be medically necessary, and therapies may continue where loss or regression of the present level of function is likely within a reasonable medical need. So again, this could be predicted, it could be seen as going on, and it's something that we're seeing that regression there, and then therapy would be a way to step in. Therapy is a little more intensive and not in the way that some people might traditionally think of it, as in physical therapy or psychological therapy. This could be something as an individual coming into the home or a patient going into a doctor's office and understanding a little bit more of what's going on. Again, going back to the nutritional therapy, you know, is there a lack of nutrition there in the individual's diet, things like that. And moving on to waivers in Nebraska. Now, waivers in Nebraska, while we do coordinate with the Office of Developmental Disabilities, and Medicaid does typically cover all Medicaid services, the Office of Developmental Disabilities is the one that administers the waivers. We do work very closely in hand, and we always make sure that if an individual is applying to Medicaid and they go through our application process, and yes, they're eligible, but maybe a waiver would help them a little bit more. We make sure to work with developmental disabilities to get them on the waiver, or at least on the waiver waiting list. And that way they can start to wait for that service. Waivers are designed to provide services to keep individuals in their home or the community of their choice. Medicaid covers medically necessary preventative and treatment services. And our 4 waivers include aged and disabled, comprehensive developmental disabilities, traumatic brain injury, and developmental disabilities adult day. To be eligible for all of Medicaid's waivers, an applicant must be a citizen of the United States or a qualified alien. They must be a resident of the state of Nebraska and receiving Medicaid. They must also meet a nursing facility level of care or an intermediate care facility for individuals with developmental disabilities. So again, they're going to need that additional assistance outside of the home. And sometimes, again, with the comprehensive developmental disabilities, this could also include living in a group home as well. And still staying with the waivers, each Medicaid home and community-based waiver has its own eligibility requirements, and each person can only be on one waiver at a time. The person may, again, they may be on a waiver while waiting for access to a different one, or they may be on only Medicaid while waiting for access to a different waiver. Some of our waivers have quite a lengthy wait process. Unfortunately, I can't speak too closely to those because I don't fully know how long some of them are, though I have heard recently that some of them are a little bit longer, and it's always better to get somebody on that wait list sooner rather than later. To be eligible for all Medicaid waivers, again, the person must reside in America, be a resident of the state of Nebraska, be receiving Medicaid, and meet a nursing facility level of care. So EPSDT versus waivers, they both include a focus on active engagement for improved health and wellness and quality of life. Again, we see a quick side-by-side here where early begins at birth and for early detection and intervention, while as for the waiver, aged and disabled eligibility begins at birth as well. Periodic scheduled preventive care at age-appropriate intervals with primary care provider. And then again with waiver, a monthly check-in meetings with a services coordinator. So for waivers, a person may not always have to go into the doctor's office. They may just be able to meet with a services coordinator and help them from having to worry about transportation or get over to the doctors. For screening for Medicaid, a physical, mental, developmental, dental, hearing, vision, and other screening are done as needed. On waiver services, these assessments are done annually. Diagnosis, a diagnostic test when a risk is identified, is how we do it over for Medicaid. And for waivers, it is not needed to provide a diagnosis. Or sorry, not intended to provide a diagnosis. Under treatment, treatment is identified as medically necessary. And on waivers, again, it's not intended to provide a treatment. And moving on to age and disabled waiver services. These services from birth to age 18 can provide assistive technology, extra care for children with disabilities, and respite. From age 18 and older, this could include adult day help, assisted living, assisting with chores, a companion, home again, home and vehicle modifications, delivered meals, so that would include Meals on Wheels, for example, independent skill building, non-medical transportation services, personal and personal emergency response systems. Assistive technology is the service under AD waiver and is limited to additional services not otherwise covered by Medicaid. This includes EPSDT and is consistent with waiver objectives of avoiding institutionalization. For personal care, the services under AD waiver are limited to additional services not otherwise covered under the state plan. This includes EPSDT and again is consistent with waiver objectives. Comprehensive developmental disability waiver services. This includes the habilitation of services that are available to eligible members of all ages. I do want to point out that we often use the word rehabilitation in everyday language. When we say habilitation, this means the teaching of services or the teaching of skills that are not already known or learned. So again, this includes adult companion services, consultative assessment services, community inclusion, workshop, in-home residential habilitation, proactive service, residential habilitation, and supported employment. Habilitation services are available to members of all ages. This includes adult day, assistive technology, environmental, home modifications, homemaker service, and so on. Developmental disability adult day waiver services. This is the habilitation of individuals who are over age 21 and they have also completed high school. The adult companion service, again, these are very similar to the other waiver service, although again, this is just a different way to qualify for the service. Traumatic brain injury waiver services are provided to eligible members aged 18 to 64. These members reside in specialized assisted living facilities. Services could include escort services, essential shopping, health maintenance activities, housekeeping services, or laundry, provision of medications, personal care services, or transportation services. QLI in Omaha is the only TBI waiver provider at this time, and we are working on expanding that as well. Personal assistance services provide additional care to assist people who experience a disability to remain in their home and community of their choice. Anyone who is eligible to receive PIS is a self-directed service. This means the individual recruits, hires, terminates their providers, and must sign timesheets. PIS has a health maintenance activity, allowing tasks previously completed by a nurse. Again, some personal assistance services. These are our essential services. So basic personal hygiene. This includes providing or assisting with bathing, shampoo, hair grooming, nail care, oral hygiene, shaving, and dressing. Toileting, bowel, bladder, and bladder care includes the assisting to and from a bathroom, on and off a toilet or commode, the diapering, bedpan, external cleansing of the perineal area, maintenance bowel care, and changing or emptying of the catheter bag. Mobility transfers and comfort. This includes assisting with mobility and with and without aids. Repositioning, encouraging and assisting with a range of motion exercises, and assisting with transfers with or without mechanical devices. Nutrition services include preparing meals, planning and preparing special diets, assisting with fluid intake and feeding. Medication services, these include assisting with administration of medications, reminding appropriate persons when prescriptions need to be filled. So an appropriate person may be a parent or a caretaker relative. All of the services described and all of the different ways that the services can be administered that I explained, that is not what they're limited to. It could include more, and it could just, flex to fit the person's needs. Supportive services. These are housekeeping tasks that are necessary to maintain the member in a healthy and safe environment. Again, this makes sure that these individuals can stay in their home and stay in the communities that they want to be in. Housekeeping includes changing and washing the member's bed linens or their personal clothing, light cleaning in essential areas of the home that's used by the member, or purchasing of food once a week and cleaning the member's dishes. Accompanying and assisting the member with any mobility transfers or other needed services for office visits can also be done. Services outside of a member's home can also be provided. Members receiving essential services may receive additional assistance outside of the home or at their work site. A member may also get assistance to travel for work as well. Oh, sorry, I do notice that I forgot something here. So these services can also include helping a member perform the tasks at their work. However, I do want to point out the caveat here that those tasks cannot be performing the whole job. That while the member can receive assistance, they do have to still be the main person to perform that job. And the final thing I have for you today is the Kate Beckett program. This provides Medicaid eligibility for children with complex medical conditions who would otherwise be hospitalized. This is for families who are not eligible for Medicaid. They may have one or more children under the age of 19 who need to use a ventilator at least for 10 hours a day, and so on. This continuous assessment, they would also, require continuous assessment and medical intervention to prevent life-threatening situations. To be just very clear with everybody, this program is not a waiver, which is why it is not listed under our waiver services. However, it is administered within the home and community-based services, so it can be used as an addition to the waivers. All Medicaid services are based on medical needs, and these can include nursing care in the home, hospital stays, medicine, medical supplies and equipment, or physician fees. And finally, I do hope that this showed up fine for your copies as well, but hopefully these all hyperlink for you. If they don't, please let me know, and I'm happy to provide those links for you all as well. I can provide them, and then we can always send them out after this presentation if needed. Again, a lot of these services you may not need necessarily to look at all the time, but if you are interested in learning more, you can always go to any of these different services for you. And finally, if you do have any additional questions after this presentation, or maybe you'll wake up tomorrow and think, oh, I should have asked that, please feel free to email me or call me. I do want to give a quick forewarning that I'm not always the best at answering my phone. I do apologize for that. But if you do give me a call, I'll definitely make sure to get back to you. And again, you can always email me as well. If I don't know the answer to your question, I'll always make sure to get it where it needs to go so that we can get you an answer as soon as possible. And finally, as well, I just want to point out that we did share a quick brochure on EPSDT for you all. This was developed a little bit ago, and so hopefully it can be beneficial when you need it. You're more than welcome to share it however you see fit. If you want to print it off, if you want to share it with other individuals who you think would benefit from it, you're more than welcome to do so. I'm going just to stop showing my screen really quick so that I can quickly put my email and phone number in the chat for you.
Okay, we
But
did have some questions come in also, so.
yeah, and I was just gonna say, I'm more than happy to take any questions that you have.
Great. Thank you for that. Thank you for that information. Very informative. So the first question, it says that EPSDT is for individuals up to the age of 21. What is the difference between, if you give just a short summary, between what is the difference with EPSDT versus adults who don't have the EPSDT?
Yeah, so some individuals may not need EPSDT if they don't have health concerns that require the additional screening. So that screening is usually going to be done for all children during their initial visits, especially as they're establishing care growing up. Of course, if they're not seeing that there's any issues going on or there's nothing of concern, those screenings will not continue to happen. As the child gets older and say something does begin to present itself, those screenings, will start back up, and those screenings will again begin to happen. If it's a situation where a health concern never presents itself, then that individual would not need to continue with EPSDT. Though we always kind of leave it out there, and the providers always try to screen for those things just to make sure that they don't need to start it up.
Okay, and I've heard it said that EPSDT is kind of the gold standard of medical care because it encompasses everything that's medically necessary under the screening and diagnosis and treatment. So I've heard it said that that's why it's implemented for children, trying to get in there, get that screening, get the diagnosis, get the testing, get the treatment, everything that they can while they're young to kind of help ameliorate some of those issues if they can. Also, when you were discussing the waivers, and just to clarify, the difference between what Medicaid covers and then what the waiver covers, would you say that Medicaid covers the medical, and then so the waiver is the umbrella, and there's the Medicaid piece, and then there's also what they call the home and community-based services, or the long-term services and supports, which are those, like you said, like the respite and the child care and all that. So technically the waiver provides the Medicaid piece, and then also those pieces to keep the individuals in their home and community.
Yeah, that's a great way to put it. I've never heard it put that way, and I may steal it if I'm going to be honest with you. But yes, so Medicaid would still provide all of the healthcare services, and then waivers step in to provide any additional services that may be needed through home and community-based services. Some of the home and community-based services, just to point out, they are also provided by Medicaid, but this is just a way that additional services can be provided to that individual. And for any reason, just as another caveat, if that person didn't need those services anymore, they would still remain on Medicaid, but they would be off of the waiver.
Okay, and then we had a question come in. How does EPSDT relate to school services? If you have a child who may be on an IEP and receives like occupational therapy or physical therapy, or how does that Medicaid, the EPSDT, play into that?
Sorry, I'm just jotting down some notes here. That's a great question, and I'm glad that it's brought up. I don't know fully how they intertwine with each other, but I'm more than happy to get that complete information for you and share it with everybody after the fact. I do know that these services, as the screenings are being done and maybe issues are being notified and identified and definitely treated, that child, those services would be incorporated into the child's healthcare. Into the child's schooling. So for example, if the child had any developmental disabilities and had to be in a separate classroom or needed additional assistance throughout school, that assistance could be provided because the additional testing was done.
Okay.
But again, I'm more than happy to get some additional information there.
Okay. And that was great information on the personal assistance services. That's a program that we don't often hear enough about, I think. Is there certain ages for that, or is that a birth is that a lifespan program? Do you know?
Yeah, that is a program that we used across all of not just individuals in waiver services, but across everybody who is eligible for Medicaid. So that would go on for anybody who's working, not just 1 through 18 or anything like that.
Okay. That is all the questions that we have had come in.
I apologize. I know it is so much information. So I do apologize there. I know that there's a lot to be thrown at you and some stuff may need to be digested.
Yes. We just had a comment come in. I believe the school needs to do their own evaluations as it relates to the child's ability to learn in the least restrictive environment. And then also a question, is the PASS program through the waiver or through a waiver, or is it separate from a waiver?
Yes, so PAS is separate from a waiver, though they're heavily tied together. I understand that can be very confusing, but yes, they are separate from each other.
And is that part of the state plan, the PASS program? Is that why it's separate from the waiver, but can also be provided under the waiver? Is that right?
Mm-hmm.
Okay. So that's a program that maybe if somebody isn't eligible for one of the waivers but needs those specific services, might look into. Okay.
And also, just as since we do mention the state plan, very quickly, that is currently going through the works of being readdressed. We are updating it as we usually do every 3 years. So nothing too crazy there, just to make sure that we're providing all the necessary information. That public hearing is currently going on, so we may see some changes and actually some additional services that we can provide through the state plan.
Would you mind explaining briefly what the state plan, what that term means?
Yeah, so our state plan is approved through CMS, and I'm sorry, I'm just trying to get rid of my PowerPoint so I can see everybody quickly. Our state plan, like I said, is approved through CMS. All of the things that we include in it do have to be approved just to make sure that it falls under their compliance. And that way, once they know we're doing it, they're keeping us on track and making sure that we're doing it properly in the way it was said. So just a quick example for you, some of that information includes maternal health care and some maternal health care extra expansions that we're looking at, some lengthening and of care if you're, have presumptive eligibility through Medicaid. That could also include some of our dental changes coming up. As I said, we have MCNA that's going to be leaving, and we're going to bring putting dental care under the health plans. So that is really some of the different things we're looking at, just to make sure that everybody's getting the care that they need. I believe off of the top of my head, let me look it up really quick so I'm not giving you misinformation.
So would you say that it's the Medicaid state plan that is, and you said it's an open comment right now, the open comment period? So
yes,
their Medicaid is proposing their plan for our state's Medicaid services, or what they would provide through Medicaid. And right now, stakeholders and anybody has an opportunity to look at that plan and provide feedback to the state.
Yes, so okay. We do have that. It's gone through our tribal consultation, so we've gotten some additional hearings through that. And I apologize, of course, the link that I just opened does not have it, but I will find it quickly before we end the call, and I'll share that information. It does have kind of a complete write-up of what's going to be upcoming and changing in that state plan, or at least what we're looking at as well, especially because there's a lot of waiver services that may be included on there. We are looking at, if it's approved, potentially adding an additional waiver that would just provide a more well-rounded care for everybody who are on waiver services. As I said, some of our waivers have a quite lengthy wait time at the moment. So the goal for that is also to help get them off of the longer wait time and onto a shorter wait time for some people who have been on it for quite some time, and make sure that they can get the health care that they need. So
Okay.
it would provide some changes here.
And if you're not able to get that, you can send it to me, and I can send it out in an email to everybody who registered, along with our MMI YouTube link, and that information on the state plan that you had asked, and then information on EPSDT in school, and then also your contact information as well. So if anybody has questions, they can contact you. So we can get all of that put together.
Perfect. Sorry, I see that my computer is being quite slow. Hopefully you all can still hear me. I apologize
Yes.
if you can't. I've shared that link. It's going to be the very first plan listed on the Medicaid public notices page. So there's a brief outline there, and then we also have, it links out to the main state plan changes that are going to be happening.
Okay. We don't have any more questions, so I think we can wrap it up and let everyone get back to their evening. But thank you again so much for all of this information. And like you said, I know it's a lot. So if anybody has any additional questions or comments or anything like that, you have my email address, but also we will be gathering that additional information and sending out an email. So you will have Jordan's contact information, and we will try and get you all the information that you need. Again, thank you, Jordan, so much for presenting for us. We really appreciate it. And
Yeah,
everybody
again,
have a good evening.
Thank you for having me.
Yeah.